Welcome back to GBN America, where I'm really honoured to be able to interview Professor Peter Pitts to talk about the congressional investigation into all things COVID, and particularly the testimony of Anthony Fauci. Professor, thank you for joining me. This testimony is going to be absolutely fundamental, isn't it, to an understanding of how decisions were made during the COVID period.
I hope so. Clearly more information is better. My fear is that it's going to devolve into political theater. Clearly we want answers. We want to know what happened in the decision-making process. I believe mistakes certainly were made. But trying to make one person viewed as at fault for everything, for all the things that didn't work properly, I think is relatively short-sighted. But again, sunshine is the best medicine, and I'm looking forward to the public testimony of Dr. Fauci on a variety of issues.
And so there's been some testimony so far, am I right, behind closed doors, and now it's going to move on to the open stage. Is that right?
That's right. Dr. Fauci testified in private. There were transcripts taken, and the members of Congress have said that ultimately the full transcripts will be made public, and that's very important. I think it's important that, one thing, for example, that they talked about was the issue of whether or not the United States should be funding research done in laboratories in China. And of course, that members of Congress want more security on those types of studies, which I certainly agree with. I think a key question is, should we be funding studies done by Chinese scientists in China? There certainly aren't any studies being funded by China in the United States by American scientists. So I think that issue is important as well.
Yes, and that's a very interesting part of it, isn't it? Where did COVID come from? Where did it emerge from? And can we find that out? Is there any evidence?
Well, I think what we've learned from COVID is that the Chinese aren't very forthcoming when it comes to information on the ground from China, whether it's where the virus came from, how lab security is being upgraded, the severity of COVID, in China. Data relative to the Sinovac COVID vaccine. The Chinese are not sharing. And I think that what is getting in the way of this investigation is a true partnership between scientists in the U.S. and China, largely driven by a lack of transparency by the Chinese government.
And this is really important because when the lab leak theory first came out in the early period of the COVID pandemic, it was thought to be one of those wild and woolly conspiracy theories that only extremists believed in. As time goes on, it's become seen as much more credible. And isn't it pretty fundamental that we get to the bottom of that before we understand how the relationship between science in different countries, particularly between the US and China, should go on in future?
Yes, I think that's exactly right. One of the issues with Dr. Fauci is that he's clearly a world expert. He's been around for a long time. He knows what he's talking about, but he doesn't broach controversy very well. He says that he wants people to simply say, yes, sir, and move on. There are lots of issues here that we don't know. Did the lab cause part of the problem? Was it caused natural causes? You simply can't belittle the claim and belittle the people that are making it. You've got to take it seriously and move forward. Otherwise, people don't have the capacity to listen. Knowledge has to be shared and discussed. It isn't simply a question of Dr. Fauci saying so, and therefore it's true. I think Dr. Fauci, with his great scientific knowledge, became part of the problem because people simply couldn't believe anything he said because he wasn't a good partner in communicating or sharing science.
And in 2020, he dismissed the lab leak theory. And that has sort of established him as a person who doesn't want to believe in it, even if there is now contrary evidence.
Dr. Fauci simply waved his hand and said that the lab leak theory was silly and preposterous, while other government agencies gave it much greater credence. He also, I think, alienated a large portion of the American population that wanted to understand why, for example, that claim might not be justified, rather than having Dr. Fauci say it's only believed by cranks. That only upsets people. It doesn't embrace people's right to know.
And that seems to me to be very important. I'm an elected politician, and people write into me with concerns about vaccines and so on and so forth. And I always find it's much better to write back to them with detailed answers to try and explain what the evidence is to show things are safe, rather than just to dismiss the view and say, that's nonsense. If I do that, then people think I've got something to hide. And I assume this applies to Dr. Fauci as well.
One of the things that I learned during the teeth of the pandemic was that rather than saying, what are you, an idiot, to people that have claims like, for example, are there microchips in the vaccine, is to say, where did you get that information? What do you think that means? Let me tell you what I know to be true. To treating their comments with respect. Because generally speaking, people that have opinions that may not jive well with the science aren't stupid. That's simply what they've been told, and they want to know the proper answer. So I think a respectful, complete response is always the best way, and that is not, unfortunately, Dr. Fauci's modus operandi.
Now, moving slightly on from this, we've got an inquiry going on in the UK, which seems desperately concerned to pin blame on named individuals for a problem, a disease that nobody knew anything about, when lots of people were trying to do their best and when lots of us made mistakes. Is Dr. Fauci the whipping boy for all this criticism, when actually it was a disease people didn't know what to do about to start with, and knowledge evolved and developed, and that was part of a process that no individual ought to be directly blamed for?
Tony Fauci loves the spotlight. He really was the face of the COVID pandemic in the United States. And I think a lot of people want to blame him for things that didn't go right, even though we were all learning as we were doing, both here in the US, in Britain, and all around the world. I think it's unfair to blame one person. I believe more in the Japanese proverb that says, don't fix the blame, fix the problem. And right now in the US, we're spending a lot of time trying to blame Dr. Fauci for 1 million deaths and the destruction of our educational and economic machine. That's not fair. It's not going to help us solve the problem and address these issues more robustly and intelligently the next time around.
And what your inquiry and the inquiry in the UK need to do is to work out, how do you deal with this challenge in future, not what did we not know at the beginning about something that was unknowable.
We need to understand what we learned from our pandemic response and plan better for the next pandemic, which clearly is going to happen at some point, rather than looking backwards and trying to blame everything on one individual, which is not going to help us move forward and isn't going to solve any problems or really answer any very important scientific and public health questions.
Well, Professor, thank you so much for joining me. We need your knowledge and elucidation of these problems to help us do better next time round. Thank you.